My name is Dr. Doe. I'm a breast radiologist at Houston Medical Imaging. What inspired me to go into breast imaging was mostly related to the patient contact. During residency, when we were learning all different aspects of radiology, we spent a lot of time in the reading room where it was dark and there really wasn't a lot of interaction with other people. When I did breast imaging, I realized that I could still have the patient contact, but also do what I loved about imaging, which involved understanding the physics as well as the pathophysiology of a lot of different diseases. So that is kind of why I decided to go into breast imaging. So breast density has to do with the amount of glandular tissue in your breast. Basically, the breast is made up of two different types of breast tissue. One is fat and the other is glandular tissue. Everybody has a different pattern and different distribution of those two types of tissues. The more glandular tissue you have, the more dense you're considered. The more fat you have in your breasts, the less dense you're considered. We grade density usually by percentage of how much glandular tissue you have in your breast. So if less than 50% of your breast is glandular tissue, then you are considered not dense. If more than 50% of your breast is glandular tissue, then we would consider you dense. So how does breast density affect mammography? The denser your breasts are, the more difficult it is for us to detect breast cancers. The analogy I like to use is when I'm reading mammograms, I'm like a hunter looking for deer. If I'm looking at a fatty breast, then that's like looking for a deer in the fields. If I'm looking at a dense breast, it's like looking for the deer in a forest. That forest can look different though, depending on the number of trees, how it's distributed. So if the deer pops up in an area where there's less trees, we may still be able to see it. But if the deer pops up in an area with lots of trees, it may be a little bit more difficult to detect it. A woman typically knows when they have dense breasts after they have a mammogram done. We are required by law to notify patients, usually done through a letter, that tells you that you have dense breast tissue. So when you get the letter from our office that gives you the results of your mammogram being normal, or if you need to come back, there should be a little statement on that letter that tells you that you have dense breasts or you don't have dense breasts. There have been studies that have shown that there is some increased risk of developing breast cancer in women that do have dense breasts. We're not entirely sure how much that risk is, but it is one of the factors that we take into consideration when evaluating if you are at high risk for developing breast cancer. Why do some women have dense breasts and others don't? Unfortunately, it's a genetic issue. It is like equivalent to having black hair versus blonde hair. So some people just have dense breasts, some people don't. If you have dense breasts, you may want to do additional screening with other tests such as ultrasound or MRI. Going back to that hunting analogy, doing ultrasound would be equivalent to putting on infrared goggles. The forest disappears and everything that you see disappears, but you might see hot spots. It's a totally different way of looking at that landscape, but an additional tool that will help us detect or find that deer within that landscape. Ultrasound is not necessarily better than mammography, but we use it in conjunction with mammography to make sure that we improve our chances of finding that breast cancer. If you are at high risk for developing breast cancer, and this would mean anybody who has a lifetime risk of 20% or greater, then we would recommend that you add MRI in for additional screening in addition to your mammogram. So any of our patients that are gene positive or over 20% lifetime risk, we recommend annual screening mammograms and annual breast MRIs. We would then use ultrasound to target any lesions that we might see on mammography or MRI that looks concerning.